All right, so um, brothers, welcome back to this a bonus feature for the Where's Elisha Men's Conference. I am so excited. I prayed about this and thought about this and said, how are we going to do this? Because I know this is very important and it's part of what we are talking about all weekend, right? And it's amazing how Lord does things. The special guest that is here with us today is a godsend, but a gifted professional, and I know that you are going to be greatly impacted and blessed by what she has to share with you. Dr. Leticia Barksdale is a top-notch, first-class professional, and I am not going to botch her information, her bio, so I'm going to read it to you. She is the founder and director of Life Change Medical, LLC, and she is board certified in family medicine as well as in sports medicine. She currently serves as the hospitalist in Fayetteville, Arkansas, and also an urgent care physician in Southern California. Um, you are looking at a very gifted and amazing professional, and I know that she is going to greatly inform us and help us. But first, there is a very cool thing that she can share with us. You heard me say that she is board certified sports doctor, sports medicine. And so she actually works with the USA, the official USA water polo team. Dr. Barksdale, welcome. Talk to us about the
Okay.
work that you do with the USA water polo team.
Thank you, Pastor Thompson, for inviting me to share. I work as the sports medicine physician, as one of the sports medicine physicians for the USA Water Polo team, and they're actually based in Orange County, California, not far from where I live. I primarily work with the junior team and have traveled with them abroad to Hungary last year, and I will continue in that role this year in other countries, serving as their team physician while they compete at different events.
So she is literally traveling the world, working with athletes, and in the sports space. So she's not just a doctor cooped up in a hospital, traveling the world, working with world-class athletes. So Dr. Barksdale, talk to us about men's health. We've been learning all weekend rather, about men's issues, depression, suicide. Can you please talk to us about men's health, physical health, emotional health, but also physical health?
It's a very important topic, and I think we hear a lot about women's health and pushes for women's health, and I don't think we hear a lot of conversation or as much conversation as we need to have as it pertains to men's health, especially in our minority populations, in our African American communities, in our Latin American communities. It's the amount of focus that we have on those topics are is low. Our men are more resistant to go to the hospital or to visit the doctors, and I think it's very important that we prevent death that can be prevented. And so I'll share that with you today. Unfortunately, we don't have as much time as we can. Each one of the topics that we'll hit on today can have its own lecture series, but we don't have that time today. So I will hit the highlights as much as possible so that you can get the information that you need. Yes, so we'll do that. So I will share with you now my screen. Give me 1 second so that you can see the PowerPoint. Okay, are you able to see that PowerPoint well,
Yep.
Pastor Thompson? Okay. So I call it Conversations from the Pew. I've given this talk uh, once before at church. And so I think that as I continue, this is something I want to do, continue different in topics of conversation as it pertains to health. I'm going to call them conversations from the pew. And so today's conversation from the pew is men's health matters. Okay, the main thing I want you to get from this is that change happens in multiple small steps. It's not just one great big step, and it's a lot of little steps. If we think of it in the big picture, oh man, I have to change this entire thing, it's something that we get really, really apprehensive about, and we don't want to move because we see it in the grandiose vision. And so if we look at it, if we chunk it, teachers use that term, if we chunk it in smaller pieces, then it's things that we can do and accomplish that will lead us to the ultimate goal. So one step at a time to get to the ultimate goal of physical wellness. And so the first thing that we want to do is talk about what God says about the subject of physical wellness. I'm not going to read all of these texts, but I just want you to get these facts. One, our bodies don't belong to us, right? They're on loan from God. He wants us to be active and he wants us to be strong. He wants us to be healthy, and respecting God and following his word has healing properties for our lives. So we'll talk about different things that we can do, how we can change our lifestyle so that we can be more in alignment with the word of God. So men, you are amazingly awesome, right, Pastor Thompson? Men are amazingly awesome. Would you agree with that? Okay, men are amazingly awesome. And that being said, let's be a little bit real. Okay, men, you don't always take the best care of your bodies that you possibly can, right? And that you don't necessarily always pay attention to symptoms at the start and present to the physician's office later on when things are a little bit more in the advanced stages. And so we want to help you be able to say, hey, let me take advantage of this. You don't go to the doctor oftentimes because you don't want to hear when something's wrong, but you're also missing hearing things that are right, or catching things early on that can be so I'm looking for, be addressed earlier on so that we don't have to get into the stage where there's nothing we can do. Okay, so these are just some men's health issues. This is not everything that men go through. These are just some men's issues. And we're going to cover maybe about the first five. We're going to talk about heart disease and diabetes and prostate cancer, erectile dysfunction, mental health, colon cancer, and heart health. And so those are the things we'll focus on today, but there are a myriad of problems that you deal with as men. Unfortunately, we can't cover them all, but we'll hit some of the highlights. So as Elder Marvin Gaye said, brother, there's too many of you dying. And I think that is a very true statement. And so let's see if we can do something to encourage you and for you to encourage others about how we can stop the deaths that we can stop. So this slide is the leading cause of death by race. And this was done by the CDC in 2018. And if you look across the board, regardless of rate, heart disease is the number one killer of men across the board. And then you see cancer there, you see some unintentional injuries, you see stroke and diabetes, but we're going to really talk about the heart disease part, the cancer part, diabetes and stroke. And so we should not only look at it race wise, but we can also look at it in age wise. And so we can look at the leading causes of death in the younger population of men: suicide and homicide. So our young men are killing themselves and they're killing each other. And that's a problem, right? That's definitely a problem that needs to be addressed, especially as we look into the suicide aspect of it, what's going on with their mental health and what we can better do to get our young men and our older men to places where they feel safe enough to be able to share and discuss their mental health. As we move on in age to our middle age years and above, then cancer and heart disease start to take over, right? And so we're going to talk about some of those things. So just a chart summary of what those two charts that we've seen: heart disease and cancer are the most common reason for death in all of males. And heart disease, cancer, stroke, diabetes, those are in the top 6 causes of death among men of all ages. So those are the things that we're going to try and address today. Heart health, which includes your blood pressure, stroke, diabetes, prostate cancer, colon cancer, and mental health. And we'll just talk a little bit about each of these. So if we go into heart health, we just talk about what is heart disease, the symptoms, the complications, the risk factor, risk reduction, and we're going to do these for each section. Give you the explanation, describe symptoms and complication, risk factors, and what we can do to decrease the risk factors. So when we're talking about heart disease, we're talking about several types of heart conditions. But for the purposes of this talk today, we're going to talk about coronary artery disease, or CAD. And some of you may have heard this before. Your coronary arteries are actually the arteries in your heart that supplies the blood to your heart. And so coronary artery disease refers to the disease in those arteries in your heart. And CAD is actually the leading cause of death for men in the United States. 1 in every 4 male deaths in the US is caused by heart disease. And so coronary artery disease is actually a buildup of what we call plaque in your arteries. And so it starts as fat and cholesterol, and then that fat and cholesterol hardens in your arteries, and it causes a blockage. And if you have a partial blockage, you can get symptoms of chest pain that come and go over time. And that's often described as angina. And if the blockage is complete and it shuts off the blood flow to the heart, then it causes a heart attack. So this picture just shows you your coronary arteries, what a healthy artery looks like, and how we start to get those fatty and cholesterol deposits, and how it forms the plaque that causes and obstructs the blood flow to the heart. So if you see there, the plaque buildup and the obstruction, the vessel is getting smaller and smaller, and so not as much blood is going through. So this is just another picture of what's going on when you have coronary artery disease. And of course, the top is normal, and the progression as you go further down the pictures, you have at the very bottom that plaque with thrombus formation. And the thrombus is pretty much a collection of red blood cells, right? It's a clot that is occluding the artery and causing a problem. And so these are some symptoms and complications that we have from heart disease. You have chest pain, like we talked about, called angina, that comes and goes and comes and goes. Shortness of breath, fatigue. You can get a heart attack, which can lead to heart failure, or you can get arrhythmia, which is just an irregular heartbeat, something like atrial fibrillation. So this is just our gentleman who has those arteries in his heart that are clotted off by the plaque and the blockage in his coronary artery disease that's causing his chest pain. So what are some warning signs, Dr. Barksdale, about heart attack? So you can have pain or discomfort in your chest. Usually that pain or discomfort is substernal, or in the higher portion of your chest and underneath. And most patients describe it as a pressure-like pain. And this pressure-like pain can move to your neck, usually the left side, or your arm, down the left arm. But it can occur on either side, but usually it's the left side. And it can cause jaw pain, neck pain, lightheadedness, nausea, vomiting, a lot of sweating, right? Or it can cause you shortness of breath. So if you are having these symptoms, if you have 4 baby aspirin at home, go ahead and take those 4 baby aspirin. Call 911, take those 4 baby aspirin, and allow them to come and take you to the hospital so that the doctors can do what they do best. And so what are some risk factors for heart disease, right? Family history, age, gender, unhealthy diet. You see them there, you can read them. The diabetes, being overweight, our high blood pressure, right? These are all things that are risk factors for heart disease. And this is not an all-inclusive list, but it is important to note that these risk factors are compounding, meaning that the more of them that you have, the higher your chances of having heart disease. And so I want it to be noted that we can't do anything about family history or age or gender, but the things that come after are things that you can do. There are things that you can change so that you do not have more risk factors for heart disease. Unhealthy diet, you can change. Physical and activity, you can change. Your blood pressure oftentimes can be changed with lifestyle management, as well as type 2 diabetes or being overweight. So all of these things we have the ability to change. And so let's talk about risk factor reduction. What do we do, Dr. Barksdale, to lower our risk for heart disease? Well, I'm going to tell you. Lifestyle management is the number one thing that you can change, right? And what does lifestyle management include? It includes making better food choices. So we want to go for things that are low fat, low salt, eat more fruit, eat more vegetables, eat things that look like me, brown, which means that they're mostly whole grains. And we want to eat less processed foods. So if we're thinking about where we're shopping in the grocery store, most of the foods that you get from the grocery store should come from the produce section, that fresh food section. If you are unable to shop in that section for whatever reason, then the next place you should go for fruit or vegetables, especially, is the frozen food section of the store. We want to try and stay away from the canned areas because those are the areas that either have more sugar for the fruits or have more salt for preservative action for the vegetables. So that's what we want to do. So we want to make better food choices, and we also want to move more. We want to exercise more. And so it is recommended that you get 150 minutes of moderate intensity exercise 5 days a week. So, or sorry, 150 minutes of moderate intensity exercise a week. And broken down, if you break it down, that could be 30 minutes a day, 5 days a week. And moderate intensity exercise sounds like this. Like I am out of breath while I'm doing it, but I can still do it and kind of hold a conversation while I'm doing that. Right? So you can walk, speed walking, gardening, biking. Those are all things that can give you moderate intensity exercise. If you are about that life and about that exercise life, all you need is 75 minutes of vigorous intensity exercise, and that can break down into 25 minutes a day, 3 times a week. And vigorous intensity exercise says, don't talk to me. The only thing that I have breath for is this exercise at this time. So you'll know you're vigorous when you don't have any breath to share for conversation. It's also important to get strength training activity, whether or not that be resistance training with bands or body weight or in the gym using actual weights. And they don't have to be heavy weights, just some kind of muscle strengthening activity is recommended 2 times a week. And we want to spend less time sitting. So every hour, get up and move as much as possible. Sitting down all day and then getting up to just do your 30 minutes of exercise is actually counterintuitive. So spend more time moving during the day. And always remember to start low and go slow. I'm not asking you to do Ironman competitions. Start where you can start. If it's difficult for you to start with 30 minutes, then start with 15 or start with 10. And you don't have to do the 30 minutes consecutively. You can break it up, 10 minutes here, 10 minutes there, 10 minutes at the end of the day. Another way that we can reduce our risk for heart disease is actually medication. And I put this at the end because most of what we can do with lifestyle management can change things, like our blood pressure can change just by changing the things that we eat and how much we move. But sometimes genetics can get the best of us, or sometimes we are not perfect and we actually don't do the lifestyle management that we need to do. So that's when we bring in the medications. So change your lifestyle, and that can help reduce the need for medication. We also want to maintain a healthy weight, and by changing how you're eating and changing how much you're moving, you're gonna have a better weight. Controlling our blood pressure, very important, especially in our communities. Keeping our blood pressure less than 120/80. And so we're talking about cholesterol as well. There are many parts to cholesterol, and it can be confusing at times, but there are different things that you've heard: my total cholesterol, my HDL, or my LDL, or my triglycerides. So just to help you understand really briefly, we want to keep our HDL high, and I have that highlighted in red. So H for high, that's the good cholesterol. Keep your HDL high, keep your LDL low, highlighted in red, both L's. LDL, you want to keep low, that's bad cholesterol, and you want to tame your triglycerides. T for T, keep your triglycerides low. And of course, manage your stress. Stress can actually contribute to heart disease, and that is a risk factor as well. Stress, just being stressed out. So what do you want to do? You want to meditate or journal, practice deep breathing techniques, exercise, seek out a counselor. And I know that sometimes we have a problem with the first one on meditation. However, I know that my word says that I should meditate on the word of God. And so sit in your quiet space and listen to the Lord speak to you and communicate with him. So now we're moving on to stroke. And so when we speak about stroke, we primarily talk about two types of strokes. They're either ischemic or hemorrhagic. And ischemic strokes are when the blood supply to part of your brain is blocked. That means the arteries that lead to your brain are blocked. And that sounds a lot like heart disease, right? Or you can have hemorrhagic strokes in which the blood vessels in your brain burst, causing that bleeding in your brain. And that can happen if your blood pressure is really high, and some other reasons as well. So when we're looking at ischemic and hemorrhagic stroke, this is just a visual reason or visual schematic. And so in the ischemic stroke, the blood vessels form a thrombus, which is this collection of blood vessels, because there's not enough room for the blood flow to get. And when blood is stagnant, it forms clots. And that's what a thrombus is. And that just blocks the blood flow to the brain. And whenever our tissues in our body don't get enough blood flow, they die, or they're anoxic, because our blood carries oxygen, and oxygen gives us life. And then to the right, we have the hemorrhagic stroke, where the vessel is actually ruptured, causing a bleed in the brain. And so the ischemic stroke is also referred to as the atherosclerosis stroke or atherosclerotic stroke. And this is the same thing that we saw back in our heart disease. The stroke is actually the same cause. So it's the same causative factors in different organs. So here we have the vessels in our brain being clotted off because there's so much plaque or cholesterol or fatty buildup, and it's causing the blood flow to the brain to be reduced, leading to a stroke. So what do we do? What are the risk factors, or what are the clinical symptoms of or signs of a stroke? So this is how we think about it. You have to be fast to spot a stroke. So the B for balance. If you're dizzy or you have loss of balance or headache, those are symptoms. The E for eyes. If there's changes in your vision, blurry vision or darkened vision, those are things you want to be aware of. The F for face. If one of your sides of your face has some facial drooping. A for arm, which is weakness in your arm, but you can also have weakness in your legs. As for speech, if your speech is slurred, those are all symptoms of a stroke. And so what do we need to do? Get to the hospital as quickly as possible. So T for time. Call 911 immediately so that you can get to the hospital, because the amount of time between the symptom onset to you getting to the hospital is reduced, there is a greater likelihood that the medical team at the hospital can do something about these symptoms so that you don't have to have permanent damage because of this stroke. So you want to be fast when you're thinking of stroke. And what are the risk factors for strokes? This list looks a lot like the risk factor list for heart disease. And so family, age, gender, race plays an important part here for our non-Hispanic Blacks or our Hispanic, whether they be Black or white, because strokes are more prominent in our minority populations, Black and Hispanic populations in particular. And once again, this list is not all inclusive, and the risk factors are compounding. The more risk factors you have, the more likely it is for you to possibly have a stroke. And what do we do to reduce our risk for stroke? Same thing that we're doing to reduce our risk for heart disease. Lifestyle management. We're making better food choices. We're exercising. We're maintaining our healthy weight and controlling our high blood pressure, our high cholesterol, our diabetes, and we're learning to manage our stress well. So now we're going into type 2 diabetes, and I want to focus on type 2 diabetes particularly because that is the main one that we have that we can do something about, and that is more prominent. There's different types of diabetes, but we'll focus on diabetes type 2. So we'll talk about what is type 2 diabetes. So type 2 diabetes is when your body isn't able to keep the blood sugar level in your body at a normal level, right? And so we want glucose in our body because it's an important source of energy for the body, for the cells of the body, and it's the main source of fuel for our brain. So glucose or sugar is good, but too much of it is bad. And so in type 2 diabetes, our body is resistant to the insulin that it makes. And so insulin is produced in our bodies to lower our blood glucose. And I'm going to show you a visual schematic of that. So we eat and our insulin levels rise to keep our blood sugar down. So 90 to 95% of people with diabetes have type 2. So it's a more prevalent form of diabetes. And pre-diabetes and type 2 diabetes have the same process. And I know you've heard some people, or maybe even yourself, has said, oh, I don't have type 2 diabetes, I only have pre-diabetes. Same pathology, same process. So I don't want you to separate the two. It's just a matter of very minimal number changes that can lead from pre-diabetes to type 2 diabetes. So it's important that we manage our insulin resistance or our type 2 diabetes now, even in the pre-diabetic stage, because it's just a continuum. And type 2 diabetes is often preventable by changing our lifestyle. So this is just a picture just to let you know where insulin is produced. It's produced in the pancreas, and it's that yellowish organ right in the middle of your upper abdomen. And insulin actually lowers your blood glucose. So stick with me, okay? When this is normal glucose regulation, this is what's supposed to happen in the normal person. When you eat food, your sugar levels rise. Then your body produces insulin, so the insulin levels rise, and it decreases your sugar level in your body, right? You're eating food, and that food causes your sugar level to rise, and your body say, hey, we got to get it down, so it makes insulin, and then it lowers the sugar level, okay? When that mechanism is impaired, this is what happens in our type 2 diabetics. We're eating so much all the time, and oftentimes the wrong things, then it produces so much sugar, up, always producing sugar because we're always eating, right? Which causes the pancreas in our body to have to put out more insulin. And instead of being able to lower the sugar, the body's just like, well, I don't even know why we're doing all of this. We can't keep up, right? So the sugar, the insulin can't do what it's supposed to do because now the body is so resistant to the insulin being produced. And so the sugar level just stays up because we're eating so much and we're eating too much of the wrong things. And when we do that, you'll see the weight gain, and type 2 diabetes increases with weight gain. And sometimes you may have it when you're thinner, and that's more of a genetics thing, but mostly it can happen in our overweight or obese populations. All right, so this is just another schematic to explain the same thing. We're eating high carb diet, and all of the processed foods, making our sugar high, causing insulin to be produced at increased rates that our body stops responding to, so our sugar levels stay high and can't be lowered like they're supposed to be. So what are some symptoms of diabetes? increased thirst and increased hunger, feeling tired and weak, or mood changes, blurry vision in the later stages if it's unchecked and uncontrolled. If your diabetes is unchecked and uncontrolled, you can have slow healing sores and things of that nature. Some complications, men, I'm pretty sure complication number one is important to you. Erectile dysfunction is a complication of unchecked diabetes, heart disease, kidney damage. You may know or may be a person who is currently on dialysis because your type 2 diabetes have damaged the kidneys. You can have nerve damage called neuropathy, eye damage called retinopathy, or you can even have Alzheimer's disease. Alzheimer's disease is often referred to now as type 3 diabetes in some sects, because it's linked to increased sugar, right? Increased sugar. And so how can we reduce our risk factors, or what are the risk factors actually for type 2 diabetes first? So we'll talk about the risk factors: increased abdominal girth, being overweight or being obese. So that just means the bigger the outpouching of your abdomen, it contributes to your risk factor for diabetes. Your race or ethnicity plays a part. Our Black and Hispanic or Latino communities have an increased risk of type 2 diabetes, as well as our Indian and Alaskan Native people, as well as Pacific Islanders and Asians as well. We have poor diet and lack of exercise that contributes to our risk factor for diabetes. And the family history. Type 2 diabetes does have a strong family history. So how do we reduce that risk? Of course, you know it by now. We've seen it twice already in heart disease and in stroke. We reduce our risk for type 2 diabetes by lifestyle management, managing what we put in our face, managing how well we move, maintaining a healthy weight, and how well we maintain our stress. So we're moving on to prostate cancer. This has a significant meaning for me because my dad was diagnosed with prostate cancer a couple years ago. I want to say about 2 or 3 years ago. I think it was the end of 2021. And so I'm going to tell you this brief story about him because it's important to see how quickly things can change. So pre-pandemic, 2018, my dad is going yearly for his annual visits. They're screening my father with a rectal exam that I know a lot of people are like, oh, not for me. But they're screening him with a rectal exam, and they're taking his PSA levels, which is prostate specific antigen, or the levels that his prostate puts out. So 2019, in 2018, his level was a little bit high, but his rectal exam was normal. His prostate exam was normal. In 2019, and so the doctor said, hey, let's watch and wait. And so in 2019, once again, the level was a little high, but his prostate exam was normal. So the doctor said, let's watch and wait. Then 2020 happens, right? Everything's shut down. So there's no visit for my dad, right? And so in 2021, I encouraged him to go to the doctor at that time. They do his blood work and they do the prostate exam. At that time, the doctor feels a little bump on my dad's prostate, and my dad's level of his prostate had doubled just in that year span. So he went to the urologist, did a biopsy, and indeed my dad had prostate cancer. And it was becoming more aggressive, actually, when we think about the numbers of how prostate cancer is defined. He had higher numbers, mid to upper numbers, in just that small amount of time. So this is important, and I want you to definitely take this in. So prostate cancer the prostate is actually a small gland in your male, and it produces the fluid that gives health to the sperm and actually transports your sperm. And so the cancer, any kind of cancer, is an abnormal growth of cells. So I call them rogue cells, and that it occurs primarily in the prostate. And prostate cancer is actually one of the most common types of cancer, and it's actually a slow growing cancer. Usually doctors will tell you that you'll die of something else before you die of prostate cancer. But I want you to understand that when it happens in Black and Hispanic communities, it is in at higher rates and it is in more aggressive form. Okay. So this is where your prostate is. It's circled and that's where it sits. Just a little walnut shaped gland. And it just shows you, hey, just an example of where a cancerous tumor could be on the prostate. And so what symptoms you have of prostate cancer? You could most oftentimes there may be no signs or symptoms if it's early enough. But if you have more advanced stages, you can have trouble urinating or blood in your urine or blood in your semen. If it spreads to your bone pain and erectile dysfunction. So what are some risk factors for prostate cancer? Age is significant. It's more common in men after 50, although it can happen earlier, more common in men after increased risk. And when it is diagnosed, it's most likely or more likely to be aggressive or advanced forms. Family history, if your dad had it, your grandfather has it, it increases your risk, or even obesity can be linked to prostate cancer as well. So how can we reduce our risk for prostate cancer? One of the things always it starts with our what we're eating and how we're moving and maintaining a healthy weight. Those are things that can possibly be helpful to reduce your risk of prostate cancer. So when you're screening for prostate cancer, if you're greater or equal to 50 years old, you can discuss the pros and cons of being screened with your doctor. And the pros and cons will include your risk factor or the preferences that you have. I suggest that if you're Black or you have a family history, you get screened sooner than 50 years old, right? And if you're greater than 70, no routine screening is recommended. And how do we screen? We screen by a digital rectal exam or by prostate-specific antigen or a PSA test, which is a blood test. And so this is a picture of what men usually don't want to happen to them. They don't want to go to the doctor to get their prostate checked because the doctor has to insert a finger into their anus to feel that prostate. And it's very quick. And I know mentally it can be uncomfortable, but it's important to be healthy. It's important to take the time to do these preventative measures. And if the finger of your doctor bothers you, choose a doctor with smaller fingers, go out there and get it done anyway. Okay. So let's talk about colon cancer. Colon cancer is another thing that is important to me, or another disease that's important to me. My fiance's mother died of colon cancer when she was 50 years old, right? Which puts my fiance at higher risk for colon cancer. And so because his mother was diagnosed at 50, we decided, or is recommended, that he start his screenings with a colonoscopy at age 40. And when he went, he had a lot of polyps already, and some of those polyps could have been were precancerous. So the fact that he went early helped to reduce his chances of those polyps converting to cancerous polyps. So this is something that I want you to be aware of as well. So colon cancer is just rogue cell growth or abnormal cell growth that happens in the colon or the rectum. It's also can be known as colorectal cancer. And it happens as small clumps of cells called polyps that form in your colon. And polyps are usually benign or usually non-cancerous, but there's some that can progress or change to cancer. So you want to get those evaluated early on and removed so that they don't progress to cancerous lesions. And so this is just a picture of the colon, different parts of the colon, and a picture of what colon cancer can look like on colonoscopy. And so what are some symptoms of colon cancer? A change in your bowel habits, whether or not you're more constipated or whether or not you're having more diarrhea. If you're having blood in your stool or some abdominal discomfort, in the advanced stages, you're losing weight without trying, or you're vomiting, feeling weak and fatigued. And so what are some risk factors for colon cancer? A diet that is high in fat or red or processed meats and low in fiber. So again, what we're eating. If you have a sedentary lifestyle, you're not moving enough, colon cancer is increased in the Black race. And again, more aggressive forms. If you're smoking cigarettes and things of that age, family history, or having inflammatory bowel disease like Crohn's disease or ulcerative colitis can increase your risk of colon cancer. So what can you do to reduce your risk? Lifestyle management, right? We've heard it a lot. Making better food choices, exercising, and if you smoke or drink, cut it out. And so how do we screen? So we start screening at age, um, the I guess the a recommendation is at 50 to 75, but given the fact that we're seeing such a high rise in colon cancer in younger ages, now they're recommending doing colonoscopies at age like 45. Or if you have a relative who had colon cancer, then you do it 10 years earlier than when they're first diagnosed, if it is younger than the above listed recommendations, meaning that if your mother or your father or your grandparent was diagnosed at age 40, then you start getting colonoscopies at age 30. And so what are some types of screening? The gold standard is colonoscopy screening. You can also do like Cologuard testing or FIT testing, where you send in those stool samples and then they'll let you know if there's any traces of blood or DNA that are indicative of cancer. And if those come back positive, or meaning that they are indicative of cancer, then or blood, then you go ahead and get a colonoscopy. So gold standard is colonoscopy anyway. All right, so briefly, we'll touch on briefly, but I don't want it to be brief, but mental health. So our mind and bodies are intimately linked, right? Intimately linked, meaning that if you are not at your best health mentally, you are less likely to take care of your physical body, right? And so we want to make sure that we are at our best health mentally so that we can then be at our best health physically. And so this is what I say: God, prayer, and therapy. All of these things are important. And I know that number three, therapy, is something that we often shy away from, especially in our minority communities, and especially for our men. They shy away from therapy because there's such a stigma placed on mental health. But I appreciate where we are in this, I guess, in this atmosphere where there's now a greater emphasis being put on mental health, and even especially for our men. So God, prayer, and therapy, very important that you seek someone. If you're feeling anxious or depressed, seek out someone who can help, because you have doctors who help with our physical bodies. If our physical body is unwell, there are physicians that you go to help, right? So that you can improve. And if our mental health is unwell, there are people and physicians and counselors in place to help our mental health be improved. So I admonish you: God, prayer, and therapy. And so these are just some honorable mentions of topics that we didn't necessarily cover, but I know the time is far beyond. But just erectile dysfunction, definitely important for men. It's way more common than you think, right? And then if you are able to say, hey, doc, I have this problem, they can help you decipher whether it is something physical that's happening or something psychological. And most cases are actually treatable. So if you're having this problem, speak to your physician, and more than likely something can be done about it. And then we have testicular cancer, which is less likely to happen, and that happens in our younger populations. And so some people recommend screening yourself because you know yourself better than anyone else, and you would just gently squeeze your scrotum and to feel your testes and see if there's anything abnormal that you feel. And so once again, I gave you a lot, right? I gave you a lot, but if we chunk it down into small steps, we can accomplish the bigger picture. And those small steps include lifestyle changes, right? Start with what you're eating. That's one step. How can we improve the way that we eat? Another step, how can I improve the way that I move with exercise, right? And so those little changes will then create this giant step that helps your wellness or your physical wellness and your mental health wellness improve. And so that's all that I have for you today. This is my contact information. If you have any questions or concerns where you don't feel comfortable maybe sharing them with your provider yet, I can help you transition to getting to a provider physically, I'm more than happy to help do that. So this is my contact information. I am a safe space for you. I want you to know that. And that is all that I have to share with you today.
Awesome, awesome, awesome. I love it. I love it.
It's a lot.
Dr. Barksdale, I think it is it's definitely a lot. But um, you know, our health is of utmost importance. If we are not healthy, then we cannot care for the next generation. We cannot lead the next generation. We cannot take care of our families. You can't do anything if you're dead.
Exactly.
So we need to care for our bodies. Thank you, thank you, thank you, thank you so much. This is a dream come true. I know that we wanted to make sure we're talking a lot about mental health, and I'm glad you talked about mental health. But I wanted us to make sure that we talked about physical health too, and you did it for us and knocked it out of the park. So thank you so much.
My pleasure. My pleasure. Thank you for having me.